Hi, Mr. Smith. My name is Beth. I'm a student nurse from Cincinnati State, and I'm going to be doing your tracheostomy care today. First, I'm going to wash my hands, ensure privacy. I did verify the order. I'm going to go ahead and check your ID band and make sure. Tell me your name and date of birth. Okay, great. I'm going to make sure I have all of my emergency supplies ready for tracheostomy care. I always want to make sure I have an obturator at the bedside to maintain an airway. I want to make sure I have an extra disposable tracheostomy tube in the size that you need. This one is a size 6 and one size smaller, which will be a size 5. I also want to make sure I have suction available, and I do. What I want to do, Mr. Smith, is go ahead and assess your lungs to see if you need for me to suction before we go into tracheostomy care. Do you have any questions? No? Fantastic. Oh, I did have a lovely Thanksgiving. Thank you. I stayed home. Okay, I'm just going to listen to your lungs. Take some deep breaths. Couple more deep breaths. Well, Mr. Smith, your lungs sound perfectly clear. Your oxygenation, your O2 sat is 96%. And so I do not believe you need any suctioning. So we're going to get right to tracheostomy care, okay? A couple of things I want to make sure I have. H2O2, hydrogen peroxide, normal saline, 0.9 normal saline, okay? I also want a pair of sterile gloves, size 8. There are gloves in my kit that I have, but I want to make sure I have a backup in case I need it. And then a tracheostomy care kit. They come in lots of different sizes and shapes, different manufacturers, but they all contain about the same things that we'll need to do a tracheostomy care. Alrighty. Just taking a look at everything we have here. It's pretty dry. I don't see a lot of mucus secretions. We got the cuff inflated here, which is great. Patient is in no distress. I have the oxygen on. This is a trach mist collar, and his oxygen is on as appropriately ordered for this patient, so everything seems in order. So I'm going to use the bedside table. I also want to make sure I have a trash can nearby, so I'm going to put a trash can by my feet. I'm going to go ahead and wash my hands again since I just moved the trash can, and I'm getting ready to get started. A, B, C, D, E, F, G. Okay. All right. What I first want to do is loosen the caps on my liquids, because what you'll find out is I'm going to be sort of one-handed as I do this skill. And if I had the caps on real tight, I'd have trouble taking them off one-handed. All right. I'm going to go peel back my tracheostomy care kit carefully. And we'll explore what's on the inside. Okay. We have, as you see, sterile gloves on the top, and there are 3 basins or bins within the kit. 1, 2, 3. And I'm going to utilize those throughout the procedure. So in anticipation, I'm just going to make sure my table is clean and dry. I'm going to make space for me to create my sterile feel. All right, I believe I'm all set up for success and ready. I'm going to go ahead and sterilely don these gloves. If I can visualize the cuff, I think I can. All right. Okay. Oh, that went on pretty nicely. And I have another cuff here. Sort of microwave together there. And very carefully. Okay. two sterile hands, right? Everything's in front of me, always in front of me, and I can see. All right, the first thing underneath the gloves is a sterile field. So I'm sterile here. I'm gonna go ahead and open this up and place it down very carefully without touching anything so I remain sterile, all right? Now I wanna set my tray up, all right? We have a couple of things in here. We have 2 long handled Q-tips. I'm gonna set those in that basin. We have a brush in case there's a dry mucus or something on the trach we need to scrub off. And I'm gonna set that on my field. And we have 2 pipe cleaners, and these would be to dry the inside of the trach, make sure we're not putting any liquids back down into the tracheostomy tube. Okay, so I'm setting that up on my field. The next going downwards in the kit is a twill trach ties. We've talked about these before. There's one in every kit. I may or may not change them. It depends on if my patient needs them changed. It's sort of if they're dirty or bloody or mucousy, you change them, and if they're not, they should be okay. You don't need an order to change trach ties. If they're dry, that's okay. You don't need to do it. You just need to change them when needed. So I'll assess and see if they're needed, and meanwhile, I'm gonna keep this on my field for now. Next is that fenestrated or split gauze, okay? And so this is we wanna make sure we keep this one out because ultimately, as you remember from the video, this is going to be the last thing that's going to go around the tracheostomy tube. So we want this split gauze kind of where I can find it later. Now, if you accidentally didn't have a split gauze or you used it while you were cleaning the faceplate, it's really important to not ever make your own. You can't just get out a scissors and cut a 4x4 because what that would do would create like fraying, and then those fibers could actually go down the airway. So you never want to create your own. You want the pre-made designated split gauze. And so I'm going to make sure I have that for the end, and I'm going to put it on my sterile field here as well. Still sterile, patient's doing well, everything's going as planned. Now, the last thing I have in this basin is several. I think I have, this is a new kit, but I think I have 4 4x4s, not split gauze, but 4x4 gauze. I am going to put 2 on my sterile field that I'm going to utilize, and then I'm going to kind of loosely bunch up 2 and put them in one of my basins. And this will all make sense as it all comes together, all right? So we all agree that I'm still sterile, everything's here sterile, everything's here sterile, and I'm ready to begin. Okay, now these are 3 basins as we talked about, and we need to fill them with the solution. Once I touch that solution, obviously, I'm not gonna have a sterile hand. So then I'm going to be operating with 1 dirty hand and 1 sterile hand. So there'll be a couple times where I have to make some decisions. Just like any other sterile procedure, you can skin a cat a couple different ways, or a lot of different ways. You just have to always make sure sterile touches sterile and dirty touches dirty. Trachs, especially long-term trachs, they call it colonized. So they can have bacteria in them that sort of sets up shop and be there, very hard to treat. And so we want to prevent causing that. We don't want to introduce anything, especially the big bad bugs in the hospital, the resistant organisms. We don't want to introduce anything to this trach where bacteria can colonize. So it's really strict in the hospital setting to be as strict as possible. It gets a little tricky, but as possible, so we're not introducing any of those big bad bacteria into the trach where they can set up shop. Okay, so now I'm ready. This is sterile. I'm going to go ahead and pour my liquids into my basins. So you can see it's already loosened, remember? And I have hydrogen peroxide. I'm going to try my best not to reach over my fields too much, but of course you have to pour it over top. I don't want a ton of splatter or splash. I put hydrogen peroxide, H2O2, in the biggest bin. Then I have normal saline, and I'm going to dilute that hydrogen peroxide. I would say about 50%. I didn't measure it or anything, but you're just shooting for equal amounts, hydrogen peroxide and saline. Now I'm going to keep the saline in my hand. I'm going to come over here and I'm going to pour some carefully without touching my supplies into each of these other 2 basins. Okay, now I am dirty, sterile. All right, we are ready to go, okay? I'm gonna come over to my patient. Now, again, I'm just gonna exaggerate this. This is kind of like a fist in front of me. This is my sterile hand. This is gonna be my dirty. So I have to do some things here. My patient's on oxygen. Well, if he's on oxygen, he needs it, right? So when I remove this oxygen to take the trach tube out to clean it, I want to make sure I'm keeping it where I can constantly return it when I need to. It wouldn't benefit him if he needs the oxygen to be without it for any period of time. So what I'm going to do is ask my partner, who's filming right now, Dr. Horton, if she will turn up the oxygen. And I'm going to encourage Mr. Smith to take a couple deep breaths because I just want to pre-oxygenate him as I'm about to, pull the oxygen away to do what I need to do. Okay? 1 breath, 2 breaths. Okay, great. So I'm going to just set it down. I don't want to like move it way over. He can get what they call like a blow by, a little bit of oxygen if it's sort of close by. It's okay, still sterile here. Just trying to manipulate it a little. How about that? Kind of close enough where it's getting a little. Okay. All right, now I have a dirty hand and I'm going to remove the inner cannula. So if you remember, you have an inner cannula and an outer cannula. This one I can see has little snaps here. Some of them twist off. Just depends. There's probably other ways to do it. This one has snaps, so I'm squeezing and then I'm pulling it out along with the curvature of the trach, right? You can obviously see it curves. You want to pull it out along with the natural curve. All right. Now I'm going to come over here. This is my dirty hand. This is my sterile hand. And I'm just going to drop this in my H2O2 normal saline bin. Now look over here with my left hand. Just because I know I'm going to be cleaning, let me just put that guy back on there close by so he gets enough oxygen. Okay, so we have some decision points to make here. We have our inner cannula taking a nice bath in H2O2 and a normal saline, all right? And that's doing its job. That's doing good. And what I need to do is I'm going to use my sterile hand here. I got a brush and I kind of just want to, what I can do is, this is a decision point right here, okay? The inner cannula is sterile and this hand is now dirty. So what I can do to scrub this is put the scrub brush in my dirty hand. The inner cannula is sterile. I can pick it up with the sterile hand and sort of scrub without contaminating anything if there's any dry mucus or what have you on there. Okay, now dirty hand, dirty brush, I'm going to discard. There's a garbage can over here that you can't see. Okay, so I got this clean and now I want to sort of dip it into my just saline bin, which is this smaller one right here. So I'm going to put the container in there and sort of rinse off any H2O2 that is in there. Again, sterile hand touching the sterile part of the inner cannula and not the part that was outside of the body. Okay? All right. Now I have a sterile hand and I have to dry this off. I don't want to, if you can see, I don't want drips coming off and going into his airway. So I'm going to go ahead over here to the dry 4x4 and give it a little tap here, and then I'm just going to set it down right there. Okay? Now what I need to do is replace this catheter. So I'm going to pick it up very carefully and hand it to my dirty hand here. So again, I'm touching just the outside with my dirty hand, not the inner cannula. And I'm going to follow the curvature of the trachea and insert and make sure, very important, that it is snapped into place, okay? And return the oxygen, all right? Okay, I'm going to discard this. I still have a sterile hand here. So what I need to do, the inner cannula is cleaned and replaced, but you can see there's some gauze here and some, I want to make sure I clean the, get new fresh gauze here and clean the face plate. So again, I'm going to remove this with my dirty hand, all right? Get the old split gauze out, discard that. I still have my sterile hand here. I'm going to go back, and there is a 4x4 soaking in the saline bath, I'm just going to go ahead, maybe give it a little squeeze into the trash can and drop it into my dirty hand, okay? And I'll start on your side here. I'm going to start in the center and work my way out, which of course are the rules of any stoma. You don't go back in, back forth, because you're introducing bacteria. You always go from the center outside. So I did one side and then I dropped it, coming back here with my sterile hand. Got a little bit of the excess saline out, dropping it into my dirty hand, and I'm going to do this side of the faceplate. Center, push, and out, and pitch, okay? Now I have, if you remember, these long-handled Q-tips, okay? So what I want to do is clean underneath the faceplate near the stoma. And again, you'll see that I start at the stoma and work my way out. So what I want to do, I have a decision point here. If I try to do this with my sterile hand, I jeopardize the sterility by getting under there. So I'm going to hand it again to my dirty hand carefully. I'm going to go into the center of the stoma and out and pitch. I'm going to retrieve the second long-stemmed Q-tip, hand it to my dirty hand, go to the center of the stoma, and out and pitch, okay? The last thing I want to do, remember, is my split gauze, okay? So I have a split gauze here with my sterile hand, and it's still sterile up to this point, and when I get to this point right here and I set it down, it's no longer sterile. The skin is no longer sterile. So at this point, I can use both hands, I'm not worried about sterility anymore, to replace the split gauze and get my gentleman nice with a fresh gauze and ready to go, and keep the oxygen nearby, okay? So throughout the task, you're just basically managing one sterile hand and one dirty hand, and sort of handing things and trying not to cross-contaminate. It's not a perfect, flawless system, but it's just a lot of decision points to keep what you can sterile, sterile, and what you do touch, not sterile. Now, I do want to show you before we go the trach ties, okay? So if we look at this gentleman has some Velcro trach ties, all right? And I'm gonna say, you know, let's change them just for the heck of it. You know, they look a little dirty. They got a little bit of solution on when I cleaned them. So I'm going to go ahead and change the trach ties. All right. So remember, they were in our kit. This is the twill tape. They call it cotton twill trach ties. Okay. You may have a friend who helps and holds the faceplate in place, but oftentimes you're by yourself. So I always put the trach ties on, the new ones on, before I remove the old ones, because remember, I am worried about decannulation. I don't want this thing coming out. So what I'm going to do, and if you can't see this, I'll try to kind of talk as I'm doing it. I'm just looping the twill trach tape through one side. I don't want it to be wrinkled or bunched up. And we're going to come around to the other side, and I'm sharing the space with the old one, so it's a little tight, but you get the point. I'm going to put one side, I'm trying to get my wrinkles out here, and then I can adjust. All right, now this is important. I think this trach twill tape could probably have been a little longer, but it's not. But this is what's really important, is to secure your trach ties in a square knot. So you tie one knot left over right, and then you tie a second knot right over left, and that is a square knot. So you can practice with your shoestrings. Oh heavens. The square knot is important on trach, so they don't come, you know, you don't want to tie a bow like you do a present. That can come undone too easy. You want to do two knots, left over right and right over left, or vice versa. That is a square knot. After much effort, we got it done. Now I have to make sure that it's not too tight, or it could cause like a pressure injury. So I want to be able to slip one or two fingers in and make sure that that's tight and secure. Now I can safely take off this old trach tie that I would dispose of And I don't worry about it, you know, beating decannulation because he's already got the new one on. Okay, oxygen's here. Dr. Horton, will you return his oxygen to the level that he was ordered? Mr. Smith, do you need anything? Do you feel okay? Great, okay. Well, I'm going to make sure your call light's in place, your bed's in the low position. I'll put your handrails up, and I'll be back in an hour with your medications.